Do you do self-breast exam?
It feels okay.
Boobs. They're right there on our chest, but we rarely take a second to give them a feel. Self-exams aren't just a fun way to spend a couple of minutes, they can be life-saving. So, what are you looking for? How do you tell a workaday boobie bump from something more serious? Because really, mine feel like cottage cheese all day. So how do you do a self-exam?
So what I ask patients to do is not necessarily to go crazy and examine themselves, but become familiar with their breasts. Get to know what your breast feels like so that you will understand what a change is. Best time is that week after your period. Once it finishes, you have your hand like this, you're just running across the breast in lines.
Lines?
I like lines. People also do circles.
What are you looking for?
I'm looking for something that feels totally different than everything else in the breast.
What are some lumps and bumps that are not dangerous?
The breast has a lot of texture to it. The breast is glandular mixed with fatty tissue. It's bumpy, and some people's breasts are more bumpy than other people's. Most lumps are benign. That's the first thing to understand, and anything that pops up overnight, like from Sunday to Monday, is usually benign, and very commonly it's a cyst. Cysts are very common after the age of 30 till a patient goes through menopause. Cysts may fluctuate with the menstrual cycle. They can be round, tender, sometimes they're soft, sometimes they're hard. Fibrocystic breast disease, little thickening in areas of the breast, may come and go again with your menstrual cycle. Fibroadenomas, which are solid benign tumors in the breast, are common up to the age of 30. Any new lump that does not disappear, that does not go away after your menstrual cycle, should be evaluated by a physician.
How often do you do self-breast exams?
Very rarely.
Probably like 3 times a year. I mean, I touch them a lot when I'm doing other things, but
How often do you think you should do breast exams?
maybe once a month.
Yes. You should get on that
Yeah, I probably should.
and think of me. Don't think of that got weird. How often should I be checking my boobs?
You know, I don't know that there is an actual answer. We used to always talk about a monthly examination, and certainly if you feel comfortable doing that and it's not going to make you nuts, you know, I would say be aware.
But don't be obsessed about
There's no
your boobs.
reason to be obsessed. Get to know what your breasts feel like so you know if there's a change.
Just have fun with them.
Yeah, if you like.
Can you do a breast exam when you're pregnant?
Sure. Is it harder to find things when you're pregnant? Absolutely. There's no question about it. Certainly, if anything pops up during pregnancy, it should be evaluated as well. And whatever we need to do, we can do when a patient is pregnant.
Self-exams are quick and easy, so go ahead and touch yourself. Unless you're on a bus. Not then. If something feels weird, head to your doctor right away. Your homework tonight, text a friend. Tell her to check her boobs. She might think it's creepy, but we are saving lives here. I'm Miss Pillows, here with self-care for growing a pair. Ta-tas for now.